to the molecular hydrogen revolution. We're here once again with Dr. Ellen Thomas. Welcome, Dr. Ellen.
Thanks, mate.
And today we're going to be talking about molecular hydrogen and its uses in insulin resistance. So, Dr. Ellen, why don't you tell us a little bit about insulin resistance and why it's such an issue?
Currently in Australia, 2 million people are suffering with what we would call a pre-diabetic state, and some people call that syndrome X or metabolic syndrome or impaired glucose tolerance.
So 2 million in Australia?
2 million. 2 million people. That's just
Wow.
Australia.
That's crazy.
So what we know is that is the stepping stone to developing full-blown type 2 diabetes. And we know that about 1 in 3 of those people that have impaired glucose tolerance will develop diabetes in their lifetime.
Yes.
So the problem with a pre-diabetic or diabetic state is the fact that your insulin doesn't work very well. So insulin is a hormone that helps blood sugar enter the cell. So what happens is, as your insulin stops working very well, the blood sugar can't get from the bloodstream actually into the cell and stays irritating the body. So when blood sugar is very high, it actually causes an inflammatory, irritating condition. And that causes damage to the walls of the blood vessels, and that can increase your risk of having a heart attack or a stroke in the future. And that inflammatory process and oxidative stress load can actually cause damage to all your other tissues. It can damage your nerves, it can damage your proteins. So it's a big problem, and it's a big problem for people's health long term. What we've found with molecular hydrogen is that it can help this process on many different levels. So one of the main triggering problems with developing that pre-diabetic state or developing diabetes is that the mitochondria have become damaged prior to the disease occurring. So mitochondria is a cell inside the cell that actually creates energy and actually changes the way we burn sugar and the way we burn fat. So what happens is, when the mitochondria becomes damaged, that causes inflammation, and that changes the fatty buildup in our cells, and that actually changes the way we use insulin and stops insulin from working well. So what we find with molecular hydrogen is, not only are we getting an improvement in the way our mitochondria work, we also have an improvement in the damage and the way that damage is mopped up. So when the blood sugar is damaging the cells, it can actually be mopped up and improved by using very potent antioxidants. So molecular hydrogen is one of the most potent antioxidants that we've found, and it can help mop up the damage that these high blood sugar levels can cause for people. So on the research, they've found that molecular hydrogen reduces markers of this oxidative stress, that it can actually improve and lower the levels of insulin, lower the levels of glucose, lower the levels of the triglyceride fats, one of the damaging fats in our bloodstream.
Yep.
And also reduce the actual damage done to the wall of the arteries.
Wow.
So as well as improving that mitochondrial function itself. So it's working both on the way diabetes and impaired glucose tolerance is formed, and the actual damage done to the body from that process.
Wow, so it's fairly complete kind of treatment
absolutely. We found with patients with type 2 diabetes specifically, when they did the trials, that the molecular hydrogen improved a level of antioxidant called the superoxide dismutase, and it also increased the production of our own adiponectin, which is becoming quite an interesting topic in looking at people that manage weight and obesity. And that adiponectin is a protein that can actually help our insulin to work better as well. So it's very exciting.
Excellent. But tell me, people with, say, type 2 diabetes, for instance, if they're on medication, can they also take molecular hydrogen alongside, or do they need to stop the medication? What's
Look, that's a very good question. What we find is that the molecular hydrogen certainly doesn't interfere with medication at all for diabetes.
Yes.
If people are on their oral medications, they're able to just continue them at their normal level, suggested to them by their doctor. We always suggest that people keep an eye on their blood sugar levels anyway. If people are on insulin, what you might find with the molecular hydrogen is that their blood sugar levels may well improve, so then they may need to adjust their doses of insulin. So it's really just a matter of monitoring things very closely and really just looking at the insulin levels that would be required. The other very exciting thing they found is that the cholesterol profiles in people with impaired glucose tolerance and diabetes improved with molecular hydrogen.
Fantastic.
So they've shown that there was a reduction in the LDLs, the actual damaging oxidised cholesterol, the one that we think is the most harmful in damaging the walls of the arteries.
The bad cholesterol,
the bad
which
cholesterol.
we shouldn't say, but
well, there's good and bad.
Yes.
With people with impaired glucose tolerance, the good cholesterol levels were elevated, the HDLs.
Yes.
So with patients with fatty liver disease, which is common in people with pre-diabetics and the impaired glucose tolerance, because the triglyceride fats build up in the liver, they found that in rats that were bred to have this type 2 diabetes, a hormone called the fibroblast growth factor actually increased and helped reduce the fatty liver disease.
Fantastic.
So that certainly is a very exciting potential benefit for humans.
Awesome. Sounds great. Thank you so much.